the related cervical spine disorders, and common treatment options. We got going a little bit late this evening, so I'll try to facilitate things as best as possible. I'd like to spend about 15 minutes going over my slides and then leave plenty of time, 15 or 30 minutes, for questions if they come in. Neck pain, as many of you know, is an extraordinarily common problem. It has a lot to do with the complexity of the human spine. As far as complex areas of the human body, our human spine is certainly one that is close to, if not at the top of the list. As you can see here from the slide, I invite you to look up the anatomy of our human spine and appreciate the complexity. The cervical spine, specifically our neck, is made up of 7 bones, or vertebra as they're referred to, and then you can see the thoracic spine, lumbar spine, and sacrum follow from there. Next slide specifically pertains to the numerous muscles that we have that make up our neck, and you can see by the anatomy of those muscles not only the number of different muscles, but also their trajectory and how many of them are going in different directions, but many of them are also intersecting at different areas. Obviously, our probably most important structure that travels through our neck and cervical spine is our spinal cord, which travels right down the central corridor of our spine. It's kind of like the conductor of the orchestra, if you will. If it's not working, all of the musicians and instruments aren't working either. And then you can see at each given segment through our neck and through our entire spine, individual nerves branch off our spinal cord, travel into our arms, and operate our muscles and provide sensation. Neck pain, as I mentioned before, and as you well know, is very, very common. Many studies have been done, and roughly speaking, there's a 2/3 lifetime prevalence, meaning 2/3 of us or more will have at least one episode of significant neck pain at any given point in time. It's been shown roughly 10 to 20% of human beings are suffering with some aspect of neck pain. What causes neck pain? That's certainly one of the most common questions I'm asked each day in my office by many, many patients. And unfortunately, as you can see here, neck pain continues to remains a very difficult problem to determine the exact anatomic structural cause in individual patients. And it has a lot to do with the numerous structural components that make up our cervical spine. And you can see here the big ones are the discs, the facet joints, the muscles, the ligaments, the nerves, and spinal cord that I alluded to previously. Most common neck pain is something that has somewhat of a gradual onset. It waxes and wanes. It's worse with stress and increased activity, and typically improves with some relative rest, and oftentimes will improve with different changes or changes in position. Sometimes it's better with over-the-counter medicines. More serious neck pain, something that could be a sign of infection or tumor or cancer or fracture, is going to have generally different characteristics. Warning signs such as fever, chills, unexpected weight loss, neck pain that comes on directly associated with some substantial injury, neck pain that awakens you from sleep at night, neck pain that is progressively worsening, and then certainly neck pain that is associated with pain, numbness, weakness of different varieties into the arms or legs. Will your neck pain get better? The good news is the vast majority of patients suffering from neck pain, well over 80%, will see their neck pain improve in short order. Studies have in general showed 80 to 90% of patients suffering with neck pain will see that pain resolve in a period of 3 months. As far as those that develop long-term neck pain, or if you look at it from a long-term perspective, 50% roughly are going to be asymptomatic, 25% will have intermittent recurrent episodes of neck pain, and then 25% with long-term neck pain, it will turn into something that is moderately disabling. A common question I get asked frequently is, I've got my neck pain, should I have an MRI? And the general answer is no, if it's associated with some of those common characteristics, because as I just pointed out, the majority of episodes of neck pain are going to resolve. The tricky thing about MRIs, which you're looking at here, is a typical example of what an MRI of our necks looks like. MRI is an extremely sensitive tool to show the anatomy of our cervical spine. However, MRIs are also very good at showing all sorts of subtle structural changes. And many of those structural changes as we age are very common and expected for the aging process, and the vast majority of those structural changes, whether it's a disc bulge or it's a subtle this or subtle that, the majority of those are incidental findings and likely have nothing to do with your current neck pain. I mentioned bulging discs. If there is a term that probably gets or is brought up somewhat the most frequently of many terms, bulging discs, herniated discs is certainly one of those that many lay people have some familiarity with, and that term is unfortunately a difficult one because there's a lot of misinformation surrounding herniated discs and bulging discs. And you can see here this slide just somewhat gives a little bit of description about the variability of when someone says a herniated disc, what exactly might that consist of. And again, I invite you to go through my talk later, or there's any number of endless sources on the web to educate yourself on the anatomy of the cervical spine. The vast majority of bulging discs are normal. As I mentioned, usually they are typically and expectedly part of the wear and tear aging process. As I put my laser pointer here, you can see this subtle bump to the back of this disc. That's considered a disc bulge or bulging disc in the vast majority of patients. That's of no clinical significance, meaning it's not causing a person any sort of symptoms. It's just it's no different than the tread on the tires of our car wearing down over time, or the sole in our shoes wearing down over time. Where a disc bulge or disc herniation becomes significant is when that bulged or herniated part of disc is in a position where it is protruding into or pushing on or pinching a nerve or the spinal cord. And this is exactly what I was alluding to here. You can see the laser pointer now. I'm circling a disc, and you can see this large black area protruding back from the disc, and the spinal cord being this black structure traveling down that central corridor, and you can see this large black mass of tissue protruding into or pinching, compressing that space around that area of the spinal cord. That can be is certainly a significant problem. But if you look carefully at several of these other discs in this individual's neck, several of those other discs have subtle bulges to them. And in this particular scenario, those other discs with subtle bulges had nothing to do with this person's problem. So what can be done for my neck pain? How do I get rid of my neck pain, Dr. Gerlach, is the common question. Bottom line, even in 2020, non-surgery treatments are the standard of care, are the gold standard for sure. Surgery for specifically neck pain without other characteristics, specifically without other characteristics being pain, numbness, weakness going into the arms or legs. Concentrated pain in the neck itself is rarely a problem that surgery is a good option for. Yes, surgery can be done. The million-dollar question is, will surgery be successful in alleviating my neck pain? And in the majority of cases, the answer, unfortunately, is no. So what are those common non-surgical treatments and they really fall into the bucket of, and this is how I talk with my patients, I call it a bucket of physical therapy, chiropractic treatment, localized modalities like your over-the-counter ice and heat, various cervical pillows, and then acupuncture, massage, ultrasound, traction. You can see some examples here on this slide of all sorts of various ice and heat applications that you can find on the web at Walgreens. Here a lady has one version of cervical traction, an at-home unit that you can find on the web. There are numerous different types of traction, and for a significant percentage of people, they can be helpful, and they're not dangerous. They're safe to be tried and experimented with, and compared to a lot of the alternatives, these are fairly simple things to start with first. Next, I made mention of physical therapy and chiropractic treatment. They represent probably the two most popular common forms of prescribed treatment, if you will. And certainly they benefit a large percentage of patients suffering with neck pain. Preventative types of measures any person can take in regards to managing their neck pain. Some obvious ones come into the category of avoid smoking and nicotine use. Strive to maintain an ideal body weight. Both of those things can be fairly challenging, but nonetheless, they certainly can help a person in managing or minimizing the pain that they have. And then home therapy programs, which are usually something you can either come away with from your treatment with a chiropractor or physical therapist, or nowadays with the web, I invite you to research neck pain and at-home therapies, because there is an endless supply of advice and various treatments that you can try that are safe at home without having to go out and without having to get a prescription from your doc. When do you need surgery? When do I need surgery is a common question. The most common indication or area when spine surgery becomes a good option, a successful option, is when either nerves, or spinal cord are being affected by something within your cervical spine. And the most common